The CDC has now confirmed more than 1,600 people have contracted that foodborne illness called Cyclosporiasis across the U.S.
The agency issued a health alert this week confirming the information. That alert also stated that another 5,000 cases are being investigated. 141 people have been hospitalized due to this illness, and while the parasite contaminates produce, it's rarely contagious. Some symptoms include diarrhea that can last for weeks. Now, more than 30 states have now reported cases, but officials say cases tied to this outbreak have not been detected here in Maine.
It has, however, reached parts of New England, so there are some precautions you can take if you're worried about it spreading. Dr. Dora Mills, Chief Health Improvement Officer for Maine Health, says if you want to minimize your chances of getting cyclosporiasis, you can shop for local produce. She says most national outbreaks of this disease are associated with mass-produced foods and bagged leafy greens. You should also wash produce carefully. Just washing doesn't always get rid of the parasite, though, so cooking produce is most effective. Mills tells us that she actually had cyclosporiasis about 10 years ago. It took a couple of weeks for her to get diagnosed, but she did get better after taking antibiotics.
I was about 3 weeks of really not feeling good at all. So I feel so bad for these thousands of people who are sick. The good news is Maine people can breathe a bit easier here. This is not a Maine outbreak.
Now, the Maine CDC has only reported 2 cases of this so far this year, but they're not linked to the nationwide outbreak. The director of the Maine CDC's infectious disease epidemiology program says there's not a huge risk for it in Maine, and cases are mostly associated with international travel.